Very pleasant and good evening, everyone. So, welcome back to our 13th session of D1 training program. So, I heartily welcome you all again. So, I heartily welcome the chairman of this training 3-1 training program, and he's also a patron of WCOP, Professor Vedagiri Ganeshan sir, and chief patrons. Also welcome chief patrons PV Ramurthy sir, Professor Girishwar Mishra sir, and Professor R.N. Singh garu. And also welcome Professor D.G. Reddy sir, President WCOP, Professor V. Suresh, Treasurer WCOP, Professor R. Subhashini, General Secretary WCOP, and Professor K. Ashok, coordinator of this program. And also welcome today's guest of honor, Dr. Kalyani Kenneth from Madras School of Social Work, Chennai. And also we have two special invitees today, Sri G. Chenna Reddy sir, who is a headmaster from Purimamilla, YSR district, and R.V. Kanch, an assistant professor from Bangalore, Soundarya Institute of Management and Science, Bangalore. So hearty welcome WCOP executive members, core committee members, and beloved participants for this another wonderful session of the 3-1 training program. So I request BGR sir to initiate the program.
Yeah. Good evening, everybody. First of all, I wholeheartedly welcome our 3 months training program chairperson and WCOP patron, Professor Vedagiri Ganeshan sir. And formally, we invite the chief patrons, Professor PV Ramamurthy sir and Girishwar Mishra ji, then another patron, Professor R.N. Singh from UP, and the so-called General Secretary, then Treasurer, Professor V. Suresh, then core committee members, executive committee members, and beloved participants. And especially, we should thank the repertoire of this program. Without her, the program will not move and it will not be a successful one. But then we also are just thankful to the course coordinator, Professor Ashok from Warangal, Telangana, the state of Andhra Pradesh, Telangana state. Just once again, here today's VIPs are with us. One is Professor Kalyani Kenneth from Madras School of Social Work. Earlier, she also extended 1 or 2 lectures towards WCOP. I wholeheartedly invite her. And another beloved, just our student, Professor Chenna Reddy is basically a headmaster from Kadapa district, and he did psychology and diploma from our Venkateswara University, and is highly sincere man. Whenever any program of IOOP or IPPSI, then any of the psychology program conducted, organized by Venkateswara University, particularly myself, he used to attend. So that is the sincerity of Chenna Reddy. And one other, one young VIP, she is from Bangalore University. She was introduced by my own teacher, Professor Basavanna, and I am also wholeheartedly welcoming that Arnami Kanchan. She is highly active and dynamic, and she is also working in one just MBA institute at Bangalore. So once again, we invite the VIPs and today just our chairperson Ganeshan sir and all other just participants. So once again, it is my wholehearted welcome to you all. Now I am just hand over the mic to Ramodevi. Please carry on.
Thank you, sir. So now I welcome our guest of honor, Dr. Kalyani Kenneth garu. So she is currently working as assistant professor and PG Department of Counseling Psychology, Madras School of Social Work, Autonomous, affiliated to Madras University. And she has been working, she has more than 20 years of experience in teaching in the Department of
guest during this course. Thank you very much, sir. I deem it a great pleasure to speak about family counseling. Family these days are no more a joint family system. We are all into nuclear family system and family counseling has become very,
First, Dr. G. Chenna Reddy, sir, who has been working as headmaster, ZP High School, Purimamilla, YSR district, has completed his MSc Psychology from SV University Tirupati in 98 to 2000 and also completed his PG Diploma in Guidance and Counseling from SV University during 2011 and 12. So I hope in his profession, this psychology is helping him a lot in improving the children. So I heartily welcome you, sir, and I request you to give a short message to the group.
To participate as a special invitee to this family counseling session, which is conducted.
Yes, sir. So now we have a special invitee, Ms. Arnavi Kanchan. She hails from Bangalore, and she did her MSc Clinical Psychology from Kuvempu University in 2014, and she also did Diploma in Psychological Counseling and Diploma in Child Psychology from Prasanna.
I'm Arnavi Kanchan from Bangalore. Yeah. Family. Before I go into family therapy or family counseling, let me define how we or any counselor view family is as. So, family is a past, present, and future of any individual. Your children where you are someday, your parents where you are going to be someday, and where your parents are today, they were yesterday where you are now. So all of us have to go through all these stages in life, and
So now it's time for Ganeshan sir to take up the charge. So I request Ganeshan sir to be in the limelight. Thank you. Welcome, sir.
Professor Govinda Reddy Garu and other members of WCOP. It is a pleasure to be here this evening and to have the opportunity of presenting on psychosomatic illnesses. That is the topic suggested by Professor Reddy, psychosomatic illnesses. Actually, we are in this mental health month, celebration of WHO mental health month, and there's a lot of relevance in the sense the mind is okay, then the body is okay, because the WHO says there is no physical health without mental health. So we have to understand the link. If the person is sad or aggressive or depressed, immediately hormones are released into the blood and all the organs are supplied with the blood which is contaminated with either anger or anxiety or depression. So the body is regulated only by the emotions of the person. And in family, it is known as the shock absorber. If a person is a teacher and has a problem in the office, or a manager, or a student, they leave the whole thing on the family. The family is known as a shock absorber. Okay, similarly, any member of the family will have a displaced aggression. Husband on the wife, or wife on the husband, or parents on the children, etc. So it affects the blood chemistry. It affects all the vital organs from brain, heart, lung, kidney, okay, and reproductive organ. Everything is supplied with energy only through the blood, and that blood is contaminated blood with anger or fear or worry or depression. Now, how to help it? For example, the previous speaker from Bangalore was telling about you have to cooperate with the family. How to cooperate with the family? I would suggest one technique. All these techniques are like games, simple games. Okay. They're also used in management development also, or in the family also. So a couple, they have come with some problem. The problem is maybe the wife is not cooperating or the husband is not understanding. Very simple behavioral prescription is, I will ask the husband to ask a question to the wife or the wife to ask a question to the husband, and the husband should not give the right answer. Suppose the question is, which is the capital of India? They should not say Delhi. They can say anything else. They can say New York or they can say Tokyo or whatever. Similarly, the other person asks something, the person gives a totally different answer. Now, what will happen? The person gets irritated because they are not getting the answer. Okay? It goes on for a half an hour. The game goes on, alternating. Anybody can ask anything. That is one thing. In between, they can say wink, but without winking, they can nod the head or put the tongue out. Okay? Should not do, you should not obey. The game is known as game of disobedience. The other party learns to tolerate disobedience. Next half an hour, the reverse happens. You ask a question, person gives the direct answer. And the given instruction, stand, other person stands. Sit, sits. Now they understand that we cannot control the other person. This is the central aspect. We cannot control the other person, and we should not control the other person. The husband should not control the wife should not control the husband, and both of them should not control the children. They should give the freedom for them to be spontaneous. But if you go on talking, nothing is understood. Now, in this program, it is like a development of a software development. The brain of the husband and wife learns to tolerate disobedience. At the same time, their brain learns to obey. So if we say obey, they won't obey. But first is disobey, then obey. It's an half an hour program. Okay? Naturally, the understanding comes. Suppose we say you have to understand. Why are you misunderstanding? Forget about all that. Okay? Stop the talking. Give exercises. These are all behavioral exercises which brings about a kind of neurological changes in the brain, and the person's habit changes. So this is one thing which I would like to suggest. And any questions or observations, comments are welcome. And there are list of psychosomatic illnesses, and some of them affect the heart, prolonged pumping in of certain emotions and certain biochemicals into the blood affects, it leads to cardiac heart disease and also kidney disease, cancer, okay, sexual dysfunctions, hypertension, bronchitis, okay, hysteria, all these things happen. Now, we should diffuse, the family as a shock absorber should diffuse the stress for the people. The family should not create stress. We have no control over the outside agencies. They may create stress, the office, the school, the business, they will create. But the family should give stress-free situation. And what is the recommendation is, the family should be able to play, to enjoy, to laugh. For that, we should train them. Okay. One exercise which I give is, I ask the family to lie down and start laughing. Laugh aloud. It's very simple behavioral prescription. When they laugh aloud, I give this even to larger group of audiences. A couple of days back, I was with some Department of Psychology, and I asked all the 100 students to laugh aloud. They were happy. But what happens is, it is not one-time laughter. Some of them have not laughed at all because they have been restricted by the parents or by the teachers or by the office. But now you give them a release only for a short while. Then it is just like a plumbing job. The water is not coming in a pipe. The plumber comes and unscrews it, and then water flows. So they need not be laughing for hours together. Even if you help them to laugh in a particular situation, that is enough. They feel that they can laugh. Okay. And in transaction analysis, they say it is a sanction. because sanction means you are permitted to laugh. Father says don't laugh, mother says don't laugh, teacher says don't laugh, manager says don't laugh, but the therapist says laugh. Okay, so the therapist is giving the sanction in TA language, transaction analysis language. And once they start laughing, what they will do, they cannot laugh aloud, but at least they will giggle, or they will be smiling, or they may be laughing inside, okay, looking at the foolishness of somebody, okay. Otherwise, they get irritated, they get depressed. How to get along with this person in the office or even in the family, okay. So there are very simple techniques to diffuse irritation and anger and stress. That's what I would suggest. If there are any specific questions or problems, then we can take them up. And Lakshman Rao Garu has come back after some time. So he has got a bundle of questions. He can start. Anybody can start.
I was late, sir. I was late because I have some visitors. I could not ask them to leave me.
Okay, that's all right.
Thank you very much, sir. And right now, the subject is very interesting. And let me settle down and see what I can ask you.
Okay. Let others take over. As usual, Professor Reddy Garu can start.
That is most welcome. He is initiating the topic so that we can know.
Yeah, because I am giving offer to Ramadevi.
Yes, that's true. Yeah, you need some warming up time. Lakshman Rao Garu wants some more time. It is in the baking now. Cake is in the baking.
Okay. Sir, a couple has come and the wife is a little dominant.
Okay.
And it is a love marriage, and he is working in some site as a site manager.
Okay.
So the wife says that whenever he asks a question, he immediately doesn't answer.
Okay.
And that it irritates her, and she feels stuck. That means unless and until she gets the answer for that question, she can't move forward.
Okay.
And she feels stuck, and she feels really irritated to talk to him.
Okay. You see, when I was a UG student, I went to a quiz program, and the quizmaster asked, which is the capital of Holland? See, we did not know about which is the capital of Holland. So I immediately said Poland, and everybody started laughing. It's an irrelevant answer. So when the wife says, I have a question, you give the answer, you give an irrelevant answer. You ask both of them to sit before you. Let her ask so many questions, 10 questions. Ask him to give irrelevant answer. The game which I have already told. Okay. Yes. So he has to speak only, but it need not be directly related to the question at all. Okay. And then the wife learns, the whole thing becomes fun. Okay. The whole thing is they take things seriously and they get angry. This fellow feels being insulted, etc. Okay, depressed. And he becomes a henpecked husband. So to come out of that, he can ask questions and she can say some nonsense. Okay. You have to diffuse the situation and change the pattern of behavior. The pattern of behavior is she questions and she wants an immediate answer. Okay, we will spoil the game and ask him to give an irrelevant answer. Okay, and he will ask a question and she will give an irrelevant answer. That's all. Tit for tat. The whole thing becomes fun, and it is to be done for half an hour. Okay, try this. It will definitely work. Now, the whole situation is there is a pattern of neurological, muscular, endocrinal behavior which has developed, which is not compatible now. What is the solution? You have to give just the opposite. If a snake bites, you have to give antidote. Okay. So what is the antidote? I ask, what is the problem? She gets irritated. Okay. This man is not answering. You ask a question, and when the fellow is not answering, ask the wife to laugh. Her mind will change. Her pattern will change. She said, come on, tell me what time you went to office today. He says, midnight, 12 o'clock. Then what she can do about it? And tell the fellow to tell all irrelevant answers. Okay, otherwise she wants the exact answer. You started by 7 o'clock, you should have reached by 8 o'clock. No, I reached by 12 o'clock. With whom you went? He can say something, I went with Rahul Gandhi. Okay, or something like that. Or some Rao, or some Reddy, some Naidu. Like that. Then the brain starts thinking creatively, the right brain starts working. Okay. And the role of the family counselor is to help people to take things easy. They have not learned to take things easy. They have learned to become serious, like their father, like mother. Okay. So it is a behavioral contagion, not genetically it is transferred from father, mother to the man or the woman, but they have seen somebody grim, some headmaster, some teacher. They have picked up the wrong model and they have not learned to relax, to take things easily, to crack a joke like that. Okay. So I would ask people to crack jokes also, because the joke always gives a twist. A kind of unexpected turn will be there in a joke. So ask people to crack jokes or read from books or from TV or from film, and ask them to repeat it from memory to start with. Then they will understand a joke gives a different turn, and it is a creative. The creative ability, the problem solving ability also improves. That's what I would suggest. Okay. I used to crack jokes also. Okay. Normal jokes, vegetarian jokes, non-vegetarian jokes, everything I will crack. To defreeze. I will do it in the school or college or with the client also, so that they will defreeze. But you should know what are the jokes, type of jokes. Then you can go and read a book of jokes, 1,000 jokes, which is available in the bookshop. And don't give any concentrated joke, but mild jokes you give. And keep the concentrated jokes to be shared only with your peers and the same gender group only. Okay. That's what I would suggest. Joking is very important part. Laughing is very important part. Making others to laugh is also very important part. And making them to become courageous is also another part. So ask them to role play, act as if you are a director, training the new actors and actresses. You can do that. Okay. Please.
Sir, one
Thank you, sir.
clarification, sir.
Yes, Professor.
One clarification. You see, earlier I was so dull in engaging people. Now, after conducting many a program since, say, way back, Indian Academy of Psychologists, we have established along back 2001, and later on 2001, and then we started Inspire Professional Psychology Society of India, Superannuated Psychology Society of India. Then we have now present World Congress of Psychologists. Now, earlier I was not able to engage continuously for 5 minutes.
Okay.
And
you are a professor. And you are a professor.
Yeah, professor, I can deliver the quotes in the classroom. I can quote examples. I became very good teacher. That is different.
Yeah,
but
good.
When people are there, common people. So when common people and my own family people in functions, now everybody is giving me a good name. You can engage people. You are a good entertainer. Like this, they are giving now comments. So that means, is there any link for the best counselorship as well as this good entertainer? My question. Please clarify.
Yes. You see, in management language, communication is control. Communication is control. You have to communicate exactly what is required. So brevity is very important. You have to be within a sentence, you have to communicate. If allowed, you have to go on talking for 1 hour with the examples, with the jokes and stories. So you should be like a rubber band. You can expand it or you can shrink it. And that will come with experience. Okay. If somebody is in a hurry, you can give a 1 sentence solution. But somebody says, I can spend more time, expand. And it is possible. If you try, it is possible. And if you are entertaining and people like you, you are a pleasant communicator. That's very important. And that means you are an effective communicator because you are the director of the distance school. Okay. In Venkateshwara, you would have met with a lot of audience. Okay. So you would have given interesting information. You know what to give, what not to give, to whom to give. All these things will come with experience.
Yeah, present, I am just without mentioning their names, particularly I am just quoting the counseling cases.
Very
So
good.
that they are really enjoying, and through that they are also
Yes.
getting relieved of their tensions. So
Yes,
that is
yes.
my point.
That is true. That is true. True. When you present a case and give a solution, it benefits so many people. Okay, like that. You are doing a very good service like that.
Thank you, sir. Thank you. Now there are from audience. All the time myself just getting clarification from our Ganesan sir, Ramadevi always raising the problems. And what about other audience? Here Payal Gupta is there and Baba Vajrala is there. I think they might have experienced many cases.
Sir, can I?
Yeah, please.
Please.
Yeah, this is Getsi Solomon, sir.
Yes.
Yes.
Yeah,
Sir,
Getsi,
I
yes.
have this. Actually, I have 2 cases. I have many cases with them.
Okay.
Today, I want to bring one case, sir, which I got recently. The problem is there are these this couple. The lady is very, very aggressive because she is not getting sexual satisfaction from the husband. She is not getting enough.
Yes, yes,
And
please.
the husband is very scared of her. He just leaves her and goes. And she has put on a lot of weight because of this. She says that why should I be fit? Why should I be fit, and for whom should I be presentable? And the husband started even disliking her body of late, and he
Okay.
wouldn't even come home. He's and there is one problem where they had fights because of this, violent fights, like throwing things around and like that. And yeah, so this has been, he says, whenever I see her, I only remember the fights that we had, her face and the reactions that she gave, and I'm not too involved.
Okay. Now, is she very obese?
She has become obese. She was 65, now
Okay.
she weighs 95.
Okay, okay, okay. Now, tell her to look into the videos of plus size models.
Okay.
Plus size models.
Mm.
Even once upon a time in
Mm.
Europe, there was more value for fatty girls. If
Yeah.
you see the older paintings, they were supposed to be more attractive. But
Mm.
nowadays, they want people to be slim. Almost they are going to the level of anorexia nervosa. Going
Right.
on, only joints are there, no muscles are there. Okay. So you tell the girl, lady, to look into
Mm.
plus size videos, models.
Mm.
Then she will start dressing very well and she will start reducing the weight.
Right.
Instead of telling, reduce your weight, don't tell plus size model. Then she will wear jeans and whatever and a t-shirt and all that. Then she will say,
Mm.
Arey Baba, this is not for me. Then she will reduce. One
Right.
of it's known as a paradoxical intention technique. Instead of
Right.
saying
Right.
losing
Mm.
weight, what everybody is telling, including the
Mm.
husband, you say, enjoy your plumpness, enjoy your plumpness, dress well.
Right.
And then you tell her you are pretty sexy. Okay.
Mm. Mm.
And then she will say, nonsense, I have to.
Mm.
So if you push her that way, she will fall this way. This is known as a paradoxical intention technique. And also ask the husband not to run away, but to catch. She will throw away one spoon. He has to catch. Okay, like in cricket. And then throw away a plate. He will catch. And then you clap. You do it in your presence. The whole thing becomes fun, you know. She will start throwing utensils.
Mm.
And he will also start enjoying. He becomes a
Mm.
sportsman, like cricket.
Mm.
The whole thing may appear to be funny and nonsense, but it has
Mm.
a purpose. Okay. Why should he run away? Okay.
Maybe, yeah, he is not able to, like, no, put up with her. He's not compatible, basically.
Hey, Baba, this is what you do. Next thing is ask him to become compatible in sex.
Mm.
That is the ultimate thing, as I have already told several times.
Mm.
Okay. If this is happening like this, if he's scared of his wife, how will they have sex? Something is lacking.
No, he's, I think, having ED issues, sir, erectile issues.
So if he is having, you tell me specifically, then I'll give you the solution.
Yeah, he is having ED and also he is not able to sustain for long.
Okay. Okay. Then you give a technique for that. Okay. It is known as stuffing technique.
Yes, sir. Stuffing, huh?
Stuff.
Right.
Stuffing technique. Ask the wife to lie down and then ask him to penetrate inside the vagina with a flabby penis, like putting a pillow into a cover.
Right.
You have to push it inside. Ask him to push the penis. Erection will come because of the vaginal heat. More blood will flow into the penis. It will become stiff. You should not say you should have an erection. The more he wants to have an erection, it will fail. That is the paradoxical intention. So let him keep quiet without expecting to perform. And the wife also should wait. She should not say, where is the erection? She should say, keep quiet. So there is a mental disciplining. Then the action will come. Once it comes, he should not move fast. He should move slowly. Breathe slowly and move slowly in and out of the vagina. And she will enjoy. And another thing, the moment she enjoys, she should start giving the sound. Okay? The sound like something like that. I've seen in the films, songs. Film songs, it is coming in Telugu films also, Tamil films also. Ask her to fake an orgasm, give the sound.
Okay.
Have an orgasm. The very touch will create orgasm. A woman, wherever she is touched, she will have an orgasm. Even if you touch the ear, she will have orgasm. Nose will create orgasm. So the woman's body is sensuous. Okay. So she's in a hurry. She wants to have an erection and have it for a long time. But if she learns to wait, then she will get excited. That is it. Okay. The stuffing technique will definitely work.
Right, sir.
And she will lose her weight.
Yeah. That
She
you
will become
already.
more attractive, like that.
Yes,
Husband will appreciate. And ask her not to beat the husband. No beating, no scolding, no use of vulgar words.
Yes,
Because
sir.
she may be doing it. That's why there should be a ban. You should run into a behavioral contract where you say you should not use such words. Okay. And things like that. So you are it's like a surgery. It's like a plastic surgery. Okay.
Right.
You must patch up work in behavior, and that will really help. Okay.
Sir, I have, if no one is asking, can I ask one more question, sir?
Yeah, you can.
Yeah, so one
I'm
more
waiting
thing.
for you. I'm waiting.
Okay. Yes, waiting for previous session also.
Right, sir.
Okay.
You can
You are
come back
most
again.
welcome, sir.
Yes.
No,
yes.
let her complete and then I will say.
No, you can start.
I have a couple who came to me, and the wife is a bit very talkative. Husband is a very quiet man.
Okay.
that is the background, and they are known to me for a long time. The wife took her cell phone and said, how do I use my WhatsApp from the regular number and convert it to WhatsApp. Meanwhile, the husband started talking. This is very simple. I should have answered you.
Okay.
She said, no, you don't answer anything. I don't understand what you say. I want to hear from him. Then I said, I can explain to you, but now you have to listen to your husband who says he wants to explain to you. No, sir, he doesn't explain to me. Even if he explains, I don't understand. You please do it. I said, okay, I explained to her. Oh, so simple. The husband says, I can sell even simpler than this. So they started quarreling. And I said, stop it here and you decide whatever you want to do. But with advice to wife, listen to him first and then come to others to ask your questions. Am I right?
Okay, you are right in one way. You have been giving them a kind of directive counseling, okay, as a wife to calm down, etc. But what I would suggest is ask her to keep quiet and ask this man, because she puts a question and expects an answer. I would say observe silence. And I will ask the husband to touch her and massage her body, especially the face, the head and the neck and the hands. Okay. And if possible, knees down the leg, and she has to enjoy that touch. The communication can be verbal, it can be through touch. In fact, she wants to be touched. Okay. And that is why she is starved of that kind of thing. So she is asking for speaking. So my recommendation would be ask the person not to talk. Lie down or in the sitting place, or you can make them to go to the room next by, ask her to lie down and he will simply touch. The communication happens only through touch. So you can call it as a touch therapy. So not directly touching the skin, but applying some talcum powder with a fragrance which the wife likes. Maybe it is sandalwood or whatever, a smell she likes, and then massage with the talcum powder. The smell is also there, she will be relaxing. Or use an oil also to do massage with oil all over the body. Then they can wipe it up with a towel. Okay. And then there is no verbal communication. Cut off the verbal communication because that is a beaten track. So I am opening up another communication, which is a non-verbal communication, which is a touch. And this is a touch therapy. But fragrance is required so that the person will relax also. Okay. And if you put them in a room and then they can massage the whole body, and she will agree, and she will reverse it and do it for the husband also. Okay. And the husband will also enjoy. No speech. Because the speech has got stuck somewhere. There is a dead end. So ask them not to do that. And even if you say, don't speak, she will speak. She won't listen. So what you do is now, simply you say, because you are an expert, you've got the expert power like a doctor. Do this, they do. Nurse says, then they do. So you have a professional power. Ask them to go to your room, lie down, okay? And then you will massage only on the exposed areas like the face and the neck, and the hands up to the elbow, and the legs up to the knee. Then after that, you leave and ask the massage to continue for all over the body. And they will easily strip, okay? And they will bolt the door and then do it and finish it and dress up and come. That's all. Then they would have calmed down, okay? And definitely there is some kind of sexual incompatibility. You ask the husband or the wife, they will tell there is some incompatibility. Somebody is avoiding sex, and somebody is escaping sex. And that need to be addressed. So whenever you have a pain or temperature, it shows there is some wound somewhere. Similarly, if there is a kind of a communication gap, the whole thing boils down to love and sex. So that has to be identified and treated. That's my recommendation. Okay.
Sounds good, sir. I think I will try this with them.
Yeah, please do. No,
I
you
will
should-
definitely do this.
you are a senior man, so your look also adds. A very young man or woman can also do it because they have the qualification. MSc, PhD, MPhil. You put the board, okay, put a coat, white coat, and say, do it. That's what the doctors do. Okay, and one unmarried lady, a doctor, young girl, delivers a baby. Okay, she is not married. She has not delivered any baby, but she is delivering. So what we should think is we should have confidence in our background, qualification. Apart from that, we should develop the guts to prescribe with a meaning. There should be a logic, okay? And the logic is always there because you are already qualified. You know what is happening. See, the talk game is not working. So it should be some other non-verbal communication which you are telling, and they will do it. And you have to persuade them to do it. If you ask the husband to touch the hand of the wife, no problem, because it is socially acceptable to massage with a powder, okay? Then he will do it again for her up to the elbow. So that is the way gradually you have to approach. Then you can ask them to move to a nearby room and ask them to bolt it and start with the toe to the knee, okay? And things like that. Then you can ask if you feel comfortable, undress and massage. If they find it difficult, go home and do it and finish the homework and come back. Because somebody will say, no, we will do it at home. Okay. Then you follow it up with a phone call and say, what's happening? Yes, we have done it. We feel better. Good. And then go to the next thing is what kind of sexual incompatibility you have. Maybe the wife is anorgasmic. She's not getting any satisfaction. Okay. Because there is a mental block. Okay. Or the man is not able to satisfy her, or he is having a premature ejaculation. That has to be sorted out. Okay, that's what I would say. And as I have already mentioned, you should ask Professor Reddy to share the X10, 10 prerequisites for sexual satisfaction. One paper which was published as part of a book is with him. I have sent it by email. Those of you who are interested in this area, you can get it from him. Okay.
Very interesting therapy, sir. I think this should work with them because they look to me, they are not compatible. Each one is questioning the other one is questioning this. And there is always a verbal fight between them. Okay. When I saw that. So this should work. I should make the husband to sit with me and say what he has to do rather than taking anything from the wife, because I used to sympathize the wife because she is not getting the proper response from her husband.
Yeah.
Maybe this should work.
Yeah. She is attention seeking. She needs more attention because something is happening there.
Yes, that's because when she can be quiet with me and same reciprocal attitude towards her husband, if she shows, perhaps the husband also will show the same attitude. Yes, say the compatibility is missing, I think, between them and verbally.
Yes.
Okay, yes. Sir. So thank you. And meanwhile, I will think of something else and let the others ask questions.
Yeah. One more clarification from you.
Jesse is waiting.
Yeah.
So yes.
Please let
yes, carry on.
Sir, I have one more case, sir, here. This case, there was this couple who came to the center and they were like, the husband constantly asks the wives to do small work at home, small chores at home. Okay. If she doesn't do it, he says like, she doesn't love me. She doesn't care for me. And every day his demands are changing, different demands he gives. And already the wife has one child who's going to school, another child who's like 2-year-old, and she has to care for him, feed him and all. And household work, she's cooking 3 times a day. She has father-in-law, all of that.
Wait.
Yes, sir. Yes, sir.
You ask the wife to bring a basket of vegetables and a cutting pad and a knife. Ask the husband to cut the vegetables before you. The onion, how to cut, you teach. Okay. And the bendi, how to cut. Brinjal, how to cut. Okay. Teach the fellow and ask him to do it. Because he has not learned to cut vegetables. To share work at kitchen. Okay. So if you say, do it, he won't do it. Make him to do it. It is like a dissection of a frog or a cockroach in the biology lab. Okay. The whole thing is people have not learned, and you are a trainer. You train the people to do it. Okay. It may look
Actually,
funny.
what he says is, I am a real estate, this thing, I am a big shot, I earn a lot.
वो तो है, लेकिन onion कट सकते हैं ना? You can do it. It's a
मना करते हैं सर उसको, like अच्छा नहीं लगता, करना अच्छा नहीं लगता. It's like, I am earning, can't she do only this at home?
When a teacher says something, the students do. When the doctor says, the students do. When a psychologist says, they will do, because you are qualified. And
Right,
you are
right.
doing it only for their good. A surgeon is operating only for the good of the patient. So you have that power which you have to understand, but you should know what you are doing. I am asking them to cut vegetables.
Confident. Right.
Ask him to do it. Okay. And the onion cutting, there is a particular way of cutting. Okay.
Mm.
And you can make small pieces. Ask the one to cut. But before that, you know how to cut an onion. I cut small pieces. Okay. So do like that. Okay. Take few vegetables and then cut. Ask him to do it. Okay.
Right.
Even in psychology lab, you have to do this way. Minnesota rate of manipulation or whatever. Okay. All those things that the examiner shows or the teacher shows and the students follow. Okay. The whole problem is people's brain has not learned to do certain things. Okay. But if you become a trainer, you will do it. Okay. The whole thing is fun. Maybe a real estate owner, or he may be a professor, he may be a surgeon. But if he's harassing the wife, you have to tell him, do little help. And he will do it because you are a specialist. Okay, okay, dentist. They say open your mouth, you open. Why do you open the mouth?
Right.
You have to get relieved of the pain. So you have the professional power to do all this, but you are doing it with purpose.
Actually, it feels good. It feels good to hear this, sir, because we're always cornered, right? Like the clinical psychologists, psychotherapists. I mean, they're all higher, and we are like we feel as if we are nothing. The words which you say actually gives us a lot of boost. Actually, thank you so much.
Welcome. Yes. Who's the ready, Garo?
Common sense point of view, I am asking just 2 questions. Of course, it is also quite helpful for the counselors.
Yes, please.
Sir, if we reveal everything to our wife A to Z openly, I think we are just more problems. We are just expecting more problems are arising through that openness. Am I right?
Arey Baba, you see, you should have your own secrets to yourself. Don't reveal everything. Don't reveal everything.
Yeah. That's what I am asking, sir. If we reveal everything, they don't understand, sir. That is the problem.
No. You can, no. The thing is, everybody has got a right to their own secrets. So don't probe into other party's secret and don't share your secret. Sometimes it may be shocking to the other party. Okay.
Yes.
So avoid that. Okay.
And one more clarification. We go on just talking in the house with wife. I think
Okay.
we are buying more problems, sir. Am I right?
Yes.
In
No,
this
no.
open conversation, I think
Yeah.
some of the just our weaknesses are just
No, no.
unconsciously we will be revealing to.
It's okay. Now, how to solve it? It is again another game. Take a coin, toss it in the morning. One side is husband side, another is a wife side. If the husband side comes, that day you are the king. एक दिन का राजा, दूसरा दिन एक दिन का रानी होगा. So whatever wife says, if the coin says it is Rani's day, you listen to the Rani.
Oh,
Like that, 15 days in a month, you will follow the Rani and Rani will follow the Raja.
yeah, very good technique, sir.
Yeah, very simple. And the whole thing is fun. She will say, no, no, today is my day. You say, okay, okay, today is your day. Next day, if the coin says your day, then you say it is my day. Then she'll say, okay, okay. Instead of trying to dominate or control, this diffuses the dominance because there is always a male dominance even at the international level. Okay, occasionally some women start dominating. Okay, they are aggressive. Okay, so you tell them also, it is not your day, it is my day. Because the coin says, and when coin says, it is not coin, it is the God says. Okay, it is Mahavishnu has told today is my day, or it is her day, Lakshmi's day, or Narayana's day. So you have to follow. Then things become okay.
Yeah, very good technique, sir. Though it is simple one, that Rani's day, this fellow should keep quiet. Whatever she says, she should oblige, honor. Just whatever says, he should nod his head, obliging, humble.
Yeah, this male brain feels that I have to dominate.
Yeah.
I have to dominate. No, no, but leave it. Arey Baba, it's a family. If you dominate, you are spoiling the whole spirit. So it is a team. The whole thing is a fun. And we do not know when we are going to leave. Before we leave, at least we should cooperate with others. Okay, and enjoy. Yamama చెప్తారు.
I have a question here, sir. Let me stop you.
Yeah,
That-
please.
If
please.
if husband accepts everything of the wife, people also will call him a henpecked. What do you say about it?
But I am telling, not always. 15 days Raja, 15 days Rani. Okay, the coin will say only that according to theory of probability. You should enjoy making your wife to become a Rani, and the wife should enjoy making the husband as the hero and the king. Otherwise, what is the fun in life? Okay, and they will do it, and it is very easy.
That is true, sir. But sometimes a wife always wants to dominate.
Yeah, yeah. No, if the wife wants to dominate, my diagnosis is she is not sexually satisfied. That has to be solved. For that, there are techniques. Okay.
And sometimes the husband also wants to dominate because male chauvinism.
Yeah, that's right. That's not good. That's not good.
The
No one should-
domination on each side is not good.
See, family is a team. Okay, they should enjoy, like cricket or football or volleyball. Somebody goes on dominating, they can't do anything. It's a teamwork. Even military is a teamwork. Surgeons are doing a teamwork. So they should learn to be a teamwork. Otherwise, the family becomes a failure. And only such people come to us. When the family has
Yes.
become a failure, they come
Yes.
to us. So you teach them teamwork. Okay, tell them, they take the leadership. Not only husband and wife, take the children also to take the leadership. Like if the son is born on a Monday he becomes the leader. Tuesday is wife's day. Wednesday is the husband's day. Thursday is the daughter's day. So she becomes the queen. and you all of you listen, and the whole thing is fun. And who knows who is going to die first? This is a very important thing in counseling. You have to say you are impermanent. Since you are impermanent, you should make others happy, not unhappy. Never make others unhappy. That's what Jiddu Krishnamurti has told. JK has told. He is from Andhra. So he has written.
Yes, sir.
People
It's
are
a very
already
famous.
suffering. People are already suffering. Don't add to their suffering. Okay? To the suffering of the husband or the wife or the children, don't add to the suffering. Then they will understand, because you may kick the bucket at any moment by a road accident or a snake bite or a massive cardiac arrest. You tell them, then they will start thinking. This is a cognitive behavior therapy. Your way of thinking changes. Okay. Like that. You may have a kidney problem and you will go for a transplantation and all that. Okay. Many people have gone. M.G. Ramachandran, the CM of Tamil Nadu, has gone for a kidney transplant. And one of his relatives gave. Which is going to fail, whether the heart or the kidney or the brain or a paralysis, nobody knows. Think about it and don't jump too much into future. Enjoy the present, help the people, be happy with whom you are. So these are the things. Cognitive behavior therapy is also there. But sometimes it may be shocking to the client when you talk about death and impermanence of the life. But then they have to understand that's the reality. Okay. Yes. Any other question or observation?
Yeah, only one clarification, sir.
Yes,
Later
please.
on, we'll just with your permission, we'll close down.
Okay.
You see, when wife starts quarreling,
Yes.
simple technique I used to suggest the husband.
Okay.
Just avoiding the situation simply, need not be there, need not stand before her. If we
Okay.
stand before her, her irritation gets increased.
Okay.
And also, we should not open our mouth.
Okay.
She go on starting and just repetitively scolding the husband, no problem. Let her
Okay.
scold, let her increase her voice. But
Okay.
this gentleman, I used to tell, you don't open it, don't open your mouth, number one. Number two, you try to simply escape from that situation.
Okay.
Husband. Or if the vice versa, the husband gets irritation or angry, just you please calm down. Or you just go to just enter into kitchen. Or even this bloody fellow, he's an unmatured fellow, he enters into the kitchen also. There also, you just simply calm down. So this is the technique I used to help the families. So we can avoid many problems.
Okay. Now,
Am I right, sir? Am I right?
you are right in one way. But another thing is, whoever is getting angry, uncontrollable anger, whether the husband or wife, they need to know how to apply brakes. Ask them, help them, train them to reduce their anger. That is one exercise. Get ready and get angry, reduce anger and relax. It is repeated 10 times. Okay. So the person tells a name. Okay, suppose I am Ganesh. Ganesh, get ready and get angry. Then tense your hands and legs and open your eyes and then breathe fast like that. But then don't go on for a long time because you will have a problem. BP will shoot up. 15 seconds. 15 seconds. After that, you say reverse command. Ganesh, reduce anger and relax. The moment it is given in the thought level, don't speak, thought level. Close your eyes, relax your fingers, relax your whole body, especially the toes and the fingers. Hang your head down, close your mouth and breathe out and in through the nostril for 45 seconds. 15 seconds of anger, 45 seconds of relaxing. Repeat it 10 times. Sitting before a mirror. Then they will know how horrible they look. The wife or husband, they will understand they look horrible when they Okay. So you can do that. It's a anger reversal exercise, as I call it.
Good.
It has been researched and which is found to be very, very effective in various cases. Like
Yeah,
that.
good technique, sir. Good technique.
Okay.
Okay, sir. Sir, Lakshman Rao, sir, anything?
That is, silence is golden sometimes. So the keeping quiet when the other man is raising, it is a good way of calming the other person rather than provoke him with equal anger would only spark a big fire there.
Okay. Now, but one cannot keep quiet. They will also get angry, or they will
Yes.
start crying. They will start crying, or they will become angry, or their body will shiver with fear. So, what
Yes.
alternative I would suggest is, if a person is being aggressively attacked by the husband or wife or the boss, ask the victim to imagine that the head of that person, you turn it like a graphics. You turn that the head of the person is a buffalo head or a dog's head. And audio also replace. It may be the sound of a buffalo or a barking of a dog. Okay, and keep quiet. That will not affect you. Again, this is a cognitive technique. Otherwise, your BP will shoot up and you will have bronchial asthma. Your BP will go up. But the whole thing is fun. Okay, you are looking at it with a different meaning, different perception. You say the whole thing is a fun, the principal, the wife or the husband or the mother-in-law. You treat them like a bulldog, okay, or something like that, and don't tell the secret to anybody. Okay, you have the right to imagine, but don't tell it to the wife or the boss. This is what I mean.
Sometimes it works in a negative way.
Okay, it's all right, but they will calm down. As far as you take it easy, they will calm down. If you react, they will overreact. If you go away, they will catch you and fire you. Okay, so you don't go away, because especially wife goes away, the husband will not leave. Hey, come back here and all that. Okay, the wife can be there and then think that this fellow is a fool or a buffoon. Okay, and then again you will be forcing, give me an answer. Okay, you simply keep quiet. Silence is the best thing. And you can't escape and go away because you are a member of the family. Okay, that's it. But the person who gets angry can go away. It is good for him. He can save his heart attack. If a person gets angry, I would prescribe to him, go away from the place where you get angry. Okay, that's what I would suggest. Not the victim, but the attacker should go away. Because otherwise he is going to have kidney problem and a heart problem and a stroke. You have to tell him. If you tell him all this, which is known as a persuasive communication, threatful communication, the fellow will calm down. Okay, that's it. Okay then.
One question here, sir. If the husband is silent and is not doing anything, some wives can shake and also instigate them to react.
But
How to manage that?
no, then he can start laughing. No, what I say is you produce incongruent responses. Don't cry. Don't keep your head down. Okay. Start laughing. And she'll say, why are you laughing? You look funny. You look funny. Instead of saying you look more beautiful, you say you look funny when you get angry. You look like Kali Mata. You say, Arey Baba, this is not good. Turn the situation to a play and a joke. That is possible. Okay.
Take everything as a joke.
Joke, yeah, that's right. Okay.
Sir, I can add something.
Yeah, please.
My observation, as far as my observation,
Yes.
people, families particularly, who gets up very early morning and doing prayers, submitting prayers to their own spiritually God.
Extra
Yes,
haircut.
whatever, yeah, whatever it may be. Number one. Number two, going for yoga for half an hour. Then going just following meditation for half an hour. So this 1.5 hours, I think that family, I think is the happiest family. That is my observation.
Yes.
Even if one person, neither husband nor wife, follows this, I think we can minimize the family problems.
Consequence.
Yeah, problems in the house, and it leads to mental peace. It leads to mental peace in that
And
family.
Also sattvic food, not rajasic
Sattvic food, yeah, sattvic food. And masala all the time, biryani, biryani, biryani. Many people, and Sudhakar Reddy, Dr. Sudhakar Reddy also used to say that a fellow who eats a full, just like up to nose, that fellow will die very soon. He said, he used to say, yeah. So that means soon after our eating meals, whether biryani or something else, at least 20% of emptiness we should maintain as far as our stomach is concerned. That fellow happened to be a healthy man, it seems.
Yes, yes, yes.
And keeping biryani in the freezer and without again eating, just one fellow also died. That's what Sudhakar Reddy also used to tell. Because these are all some of the simple things the public also should know.
Some disciplining.
Yeah, well, yeah, self-discipline. Yes.
Discipline
Right,
is
sir.
not there. They will become sick.
Yeah, yeah. Shall I conclude, sir?
Yeah, please do.
Yeah. Yes, Rapporteur Ramadevi.
Okay, that was really an excellent session. So hope everyone got their solutions to the problems, even if it could be personal or the relatives or the friends or anything. And I hope we can suggest them. So that was really a wonderful session for today. So hope we all enjoyed it. So on behalf of WCOP, I would like to thank all the special invitees and guest of honor for today's session, and also the resource person Ganeshan sir for his valuable time he has taken up to solve the issues of the people, of the participants, or in training the participants and to become more better confident. So I would like to thank each and every participant for their patience listening and noting down the points, whatever the sir has given us. Thank you so much, sir. Thank you, BG Reddy, sir, for being the pillar of the program, and Ashok, sir, for coordinating the program. Thank you, each and everyone, and have a good and pleasant evening.
Yeah. One more thing I forgot to add. 14th, I think, 14th, 15th, 16th. Just I circulated our Professor Ganeshan sir's just acting as a resource person at Lucknow University. Almost all people, all professors and all WhatsApp groups I circulated. I think our family counseling group as well as earlier training group also just they have inquired and I gave answers to them also. And similar such program soon after completion of our this 3 months training program on family counseling, we will also go for it. We see very, very, very current problem, very quite important one also. So all of you just that is the free program, and madam is so kind enough, Madhurima Pradhan madam, and you can also just many of our participants have shown interest, and I clarified those doubts also with regard to it. Some of the people raised that the link is not opening, and just I obtained some help from them also. I helped our own participants. So kindly participate and make use of the services of our Professor Ganeshan sir. Okay, thank you very much. Good night to all.
Good night.
Good night.
Good night, sir. Lakshman sir, good night. Thank you all.